I'm really excited to be here today to get to share with you a little bit about what I do and why I use medical cannabis in it, and why I'm trying to help the hospice and palliative care industry adopt this more and more, because it is such a powerful tool in this area of care. So we'll start with a little bit about who I am. So I was a registered nurse and a traveling nurse, worked mostly in the ER throughout the country for years, and then started to really see that we were doing things in our traditional medical care that if patients felt empowered or had a voice, they would probably start to say, I don't want that. So I went off to New Zealand and Australia, and unfortunately that picture's a little small in this venue, but it's me hanging out with a cool koala. So I went to New Zealand and Australia, and I was trained as a death doula, similar to a birth doula who believe in helping patients to do end of life on their own terms, integrating holistic therapies, and really supporting a patient and family in whole person medicine, which also now gets to include whole plant medicine, which is wonderful. So I created a company called Changing the Face of Dying. And life decided to give me a whole bunch of experience really fast at that point, and we'll get into that in a minute. Going out of a period of time of working at home, I started to work more in the hospice and palliative care industry. The last few years I've been doing a lot of community education and educating hospice and palliative care about how to integrate, how to use the Mark Bushy Compassion Program, and how to link our patients, especially those that want to use alternative therapies, to those opportunities. Most recently, I've been training with the Healer.com and Dr. Sulak program who do microdosing. So we want to get more information out to our patients on how to use cannabis responsibly. I find that especially in my population, a lot of older individuals, they don't want the psychoactive properties of cannabis. Microdosing is a very powerful way, but there's also a good use. They come to me saying they don't want the psychoactive properties, but we help them to understand too, there's a reason to use those things and to integrate some of that. So it's been a great program with Healer.com, and I continue to bring this education to our community. So what is palliative care, for anybody that doesn't know? First of all, palliative care is whole person medicine designed to treat symptoms, helping people that are living with a life-limiting illness or prognosis. But palliative care in itself still has plenty of room for curative medicine. Then you move into end-of-life and hospice care, so the end-of-life and terminal care. So what we say is all hospice is palliative care, but not all palliative care is hospice. And there's room within the whole continuum of palliative care to integrate holistic modalities of medicine, including cannabis. Because a lot of what this is about is how to control a patient's symptom profile to help them feel better in their day-to-day. And if any of you, I bet a few of you use cannabis, you know that there are lots of ways that cannabis can help you feel better, whether it's improving your sleep, whether it's improving nausea, or whether it's giving you that little bit of euphoria that helps you relax and reduce anxiety. So again, we go to the patient-centered care. The patients are asking for it, and that's what's been really fun to see in the last few years. When I first started doing this, maybe 1 in 20 homes, I'd have a curious family member maybe ask me something on the sly. Now, often I walk in and I see a pipe or a bong in the home, or they've got a container of salve, or they're just flat out asking me, can we use this? And how can we use it safely? So that's a big argument for why our hospice care clinicians, our nurses, and our doctors need to understand how this safely integrates into care so that they're giving their patients the best information. Even if they're not writing for cards, even if they're not giving dosing or usage information, they need to understand how this interacts or doesn't interact so that they're at least giving not giving bad information to the patients, not telling them that they shouldn't be using this, not telling them that it's going to put them at risk when it isn't. It gives them an opportunity to get really good results with a lot less side effects in many cases. Each person is different, so it is a matter of trying what works for them. And then euphoria, or getting high, does have its benefits, especially in the end-of-life space. This is a really hard period of time for people. So those euphoria effects of THC can help people to just step back a little bit from what's going on and let their good senses heighten and enjoy a few minutes and some laughter and open up those really good conversations. And we get the positive effects of many symptoms. We know improvement of nausea, improvement of appetite, as we've already talked about today, pain, spasticity, and a huge effect on neuropathic pain that we don't see with a lot of the opioid medications. Improvement of mood, and improved sleep. Now, if we can get a patient a good night's sleep, almost everything feels at least a little better the next day. So that's a huge place that using a little bit of THC combined with CBD or THC alone can make a huge difference in a patient. And we don't have to that doesn't have to make them psychotropically changed. It doesn't have to shift everything. They can just take a small dose at night, get a really good night's sleep, and we're dealing with an entirely different patient profile the next day. It's a low-risk profile adjunct to traditional medications too. There aren't a lot of places that we found that it has an extreme impact on the absorption of other medications. We have a list of some places that it does have an effect, mostly things that are liver metabolized. But as you mentioned before, most of those things, it takes pretty high doses. Most of my patients in the hospice realm are using pretty low doses. One of the most common questions I get around that is the effects with Coumadin. And again, you already addressed that, thank you very much. It takes really high doses to start affecting that INR. And usually those patients that are still on Coumadin in the hospice realm, they're tested like any other Coumadin patient, usually at least once a month, but if there's something going on, more often, to make sure that their INR levels are staying within the appropriate range. We often can lower the need for opiates and barbiturates so that those patients that are taking medications that they're worried about their risk for addiction, even though we tell them it's kind of silly to worry about, it's their worry. I can't take that away from them if that's their concern, and I can give them something that will help them use less of those medications. That's great, and this is a great option for that. The other thing is those medications have huge side effect profiles. People don't like the way they make them feel, and a lot of times we can achieve a better effect that people like better using medical marijuana. And then a lot of times we're trying to combat a lot of things using antidepressants, but when you're talking about somebody, especially in the end-of-life space, using something that takes 6 weeks to onboard, and then you potentially have to dose adjust, well, that's a lot of time we don't have. So using medicinal marijuana, we can often get a faster response in trying to treat the same symptoms. And this is always a good reason. I was actually getting ready to do this talk this morning. This is a very different talk for me because usually I'm asking questions and integrating with my audience. I'm thinking to myself, okay, you're gonna do this, you're gonna do okay. Go knock them dead. Oh God, stay away from the death humor, Amanda. But there you go, got some anyway. So for me, my experience with medical cannabis started during my universe deciding I was going to get some trial by fire. And when I got back from New Zealand and Australia, my grandmother at 87 years old fell. And that fall broke her ankle and made it impossible for her to return to living at home alone. So after a hospital stay, surgery, an attempt at rehab in which she went, if you're going to do this PT, that's fine, but I'm not going to do it. We decided that she would come home with me. We thought we were only going to have a few weeks. She was really struggling. She didn't want to get out of bed. She had a ton of anxiety. We had 8 months. So we came home on hospice. When we started that journey, we were using the traditional hospice medications. She was on an antidepressant that she had been on for years that hadn't been dose adjusted. We had a pressure wound on her heel that we were trying to clear up from her rehab stay. We had a surgical incision that we were still trying to heal. She had a relatively low pain profile, even though she had this break. Old Mainers, they're pretty good with pain in many ways. But anxiety, low appetite, things that we often see when somebody is really winding down from old age and debility. So every time I tried to give her something to help with anxiety, lorazepam, she went through the roof. We had screaming matches, and it was hell. And about 3 months into this process, where I mostly was just not medicating her for anxiety, we were battling through it, and she wasn't getting out of bed at all, and care was an issue because even trying to turn her, falling anxiety makes somebody resist that because even in a bed, they think that they're gonna fall out. I had a friend suggest to me, why don't you try medical cannabis? And we started doing some research, and we found the Mark Bushy Compassion Program. And talked to Graham. It's like, I don't know how I'm gonna get my grandmother to consent to taking pot. But I was just crazy enough to try, and I'm really glad we did. She was a gardener all her life, and she was totally up for it. She took a little bit of convincing. She said, well, if you're not gonna give me that shit anymore, excuse my language, meaning the Ativan, she was all for trying something that might help with the anxiety, that might help us get us through those places where she and I were constantly butting heads in just trying to take care of her. So we signed up with the Compassion Program. She was the third person on the Mark Bushy Compassion Program. We tried the chocolate bars, we tried tincture, we tried the capsules. She didn't like swallowing those things, she didn't like the taste. It was early in the program, it was early in the dispensaries, and they were still developing and making those products taste better. So we decided that I would start making her products at home. That was my first really sad attempt at making her chocolates. We ended up most of the time making her caramels, which she loved. Within a month or so, we had really gotten a good control on her anxiety. She still didn't want to get out of bed, maybe because I was testing the caramels. I didn't mind so much. We had some really great times. We painted this giant tree, family tree on my wall. She sat there like a queen, dictating how we were gonna do it and what went on the family tree. And we made some great memories in 8 months that I honestly would tell you, we wouldn't have had all of that time if we hadn't shifted our focus of priorities and our way of medicating her to create a better environment, to increase her symptom control, increase her appetite. So what we did was we would use the edibles. I'd usually give her something in the morning, and at night before bed, we'd use a sativa in the morning and then an indica at night. And then if she was especially crotchety in the afternoon, I'd throw her an extra edible, see if I could improve. She had some skin issues, as we talked about, so we used the topical salve, and really in very quick time, we got control over any areas that she had itching or rashes, and those areas that had been problematic with the pressure wound and the surgical incision healed extremely fast. And again, this is only anecdotal evidence, but I've seen it time and time again. I put salve on a wound and I increased my healing time, or I improved my healing time. Her appetite improved. She did have some baseline issues with nausea. Those went away. We had taken her off all of her pharmaceuticals at the same time, so we took away that antidepressant. Not sure if the fact that she hadn't been dose adjusted for so long was adding to her anxiety. So once we did that and we just went to using medicinal cannabis for her, We also watched all signs that had started to creep up of dementia. Those all went away. She was pretty much clear as a bell for the rest of the time that she was with us, until she was actively dying. As I mentioned, she had a relatively low pain profile. She had arthritis in her knees. Every once in a while, especially when the weather was bad, that would bother her. And we put the salve on it, and we usually had no further complaints. And sometimes I think that was as much because we were touching her and interacting and reassuring her. But I don't care why, especially in that situation, I got the result. I'm just glad we did. So there are multiple benefits to using a topical, and one of them is that it does require touch and massage to use. So key things to remember in this: consent is important. We were open and honest, and she was able to accept it. I come from a traditional healthcare background. I don't ever advocate for somebody to sneak in and give this to their grandmother, mother, family member of any kind without telling them what they're taking. We all want to live on our ethics and our terms. So please try to be respectful of that. Even if you think this is a great medicine for somebody, if it's against their belief system, please be respectful of that. Cannabis is often a great adjunct therapy, but it may not be appropriate as the only option. So a lot of times in the hospice and palliative setting, we have people that are on high amounts of narcotics or other medications because they do have a lot of pain and symptoms. It's not a good idea to try to encourage them to come off all of those and replace them straight out with a medical marijuana regimen. That's a great place to set them up for not succeeding and being in a lot of pain, because while we can do a lot with medicinal marijuana, it's a situation where you need to try to taper and see what you can wean them off of instead of potentially putting them in crisis. And a lot of people will come with that expectation. They want dosing information so they can just get off all of this stuff. But most of the opioids and these medications need to be weaned off anyway to help somebody keep away from a withdrawal status. And we want to slowly taper the effects and taper up their use of medicinal marijuana so we can get to a good therapeutic window with their medicinal marijuana use and maximize the synergy between opioids and other medications and that regimen. Go low and go slow. So start at a lowest dose and give it a few days. Sometimes we actually see that the dose that works for somebody in the first few days might go down. So they take a 10 milligram starting dose, and you could actually reduce that to like a 5 milligram dose as their endocannabinoid system wakes up. So if it's somebody that's completely cannabis naive. So you really want to, especially with somebody that's never used cannabis before, start at those really lower numbers and get some help from somebody that knows how to do this, whether it's your dispensary, whether it's one of the integrated medicine doctors that's around that does dosing, or someone like myself, but work with them to figure out how to schedule changing medication doses so that you can track what changes you're getting. Have alternatives and backup plans for breakthrough pain, especially if somebody's on hospice. You may get to a place that you're just using medical cannabis or you've got a regimen, but it's always important to have those safety nets. So if you're working with a hospice, to make sure that you have some alternatives for those severe symptoms. Use your resources. So we were supported by the Compassion Program, and I'm thankful every day that we were, and I continue to try to get out there and recommend this program to our patients in hospice and beyond. We also had the supports of hospice for traditional medicine and knowledgeable friends and family. It's always important in a situation like this to engage as many resources as possible. And then there's been a lot of change and growth in the industry since 2016 when we were doing this. So there's a lot more product out there, a lot more variety, and there are definitely ways that I would dose her differently now, different products that I would use. One of those big things is the concept of using an edible or a tincture, something that's absorbed more in the gut. So you can, of course, take a tincture and let it sit in your mouth and absorb it mucosally. You can also swallow it, or you can use a capsule so that you get more of the gut, slower absorption. When you use a slow absorption like that as a base, it kind of acts, if you think of a long-acting pain medication. So one of the things that I like to do with my patients is get them on some gut absorbed form, so that's their long-acting base. And we'll do that 2 or 3 times a day. And then we may have a tincture that they use the oral mucosa to absorb it, or we may use vaping, or we may use both of those things, or a different form of edible that they'll either suck on, like a candy, as a breakthrough type of medication. So it's almost like using Oxycontin and Oxyfast. So you're using a long-release medication to control their base level of pain, and then you have a fast-acting for breakthrough pain. And of course, we have a greater understanding that changes every day. So much like you, I look at the science one day and I go, okay, I've got this, I understand it. And I look at I thought I understood that yesterday, but it's completely different today. But that's really exciting, and I love watching how the science continues to emerge. Some of the things that I often find out in the marketplace that people think, I have a lot of my clients that come to me and they say, I just want to use CBD. I don't want anything to do with THC. I don't want to feel high. Okay, that's great, but you have advanced cancer and no appetite. We can try it, but what you may not understand is that for a lot of people, CBD actually lowers appetite. So you may be the exception, you may not have, so we can try that for you, but please be open to trying some THC with that, and we can see how we can balance them to make you not. So there are a lot of things that we've learned about the way some of these things work, and there's a lot of misperception in the marketplace. The use of CBD and THC synergistically. So a lot of the things that our previous panelists have already talked about are things that I would integrate more into my practice, and I do now, in helping people choose what products to use and how to balance their levels of CBD usage and THC. And I'm not that person that goes into the dispensary and says, go look for the one with the highest level of THC, and that's the one you want. Because for most patients, those are the ones, especially for mine that are a lot of times cannabis naive, those are the ones that are gonna take them right past their therapeutic window, and they're gonna start getting those negative effects of feeling that like their heart's racing or some of the paranoia. And we can balance that out with CBD to some extent, but if we can instead use a more therapeutic medication for them and get them right inside their therapeutic window, we'd rather do that. So the barriers to doing this are a lot of our agencies, especially our hospices, are still mostly Medicare funded. Medicare is a federal program. As long as things remain federally illegal, our companies hide behind, and reasonably so. I don't want hospice to become defunded either. Do I really think it's that much of a threat? No, I've been doing this for quite a while, and I don't really see our Medicare auditors coming in and looking for mentions of medicinal marijuana against, and looking to pull funding from a dying patient. But I understand to some extent why the companies are concerned about it. So it is hard to get hospice to play well with medical cannabis. Sometimes they'll let us in to educate, so some of the nurses will know how to use it, but they can't go out and offer these programs freely to hospice patients. I think there should be a pamphlet handed to every hospice patient on admission that shows them they can get the benefit of the Mark Bushy Compassion Program if they're interested in applying. Of course, maybe the Mark Bushy Compassion Program doesn't need that volume of applications, but maybe that would push the state to say that should be something that we're looking at asking our bigger dispensaries to do as part of responsible business owners in the state, is extend those courtesies and those programs to our vulnerable populations. So it is hard to get hospice to play well with the use of medicinal marijuana. They won't dose, they won't give advice on it. They usually will only talk about it if it's brought up by the patient or family. But on the other hand, we have a lot more third-party clinicians that are out there, a lot more information in the dispensaries here in Maine. So there are a lot more resources out in the community now where people can get that information and things like this. There's still a lot of general stigma here in the state. among the doctors, among the big healthcare conglomerates. It can be hard to get an elderly person a card, to get their oncologist to agree to use, especially if they're still doing curative treatments, because there's just a general lack of understanding, feeling like that's going to conflict with something that they're already on. And rather than going and getting the good science, we do have still a fair number of clinicians that will just say no. Or we still have several health systems that say they won't write cards. And we still, in this country, have the lack of solid research, which people have talked about before. We hope there will be more. We're working on creating more, and there's definitely more research going on outside of the US. And then there's the supply issues that we just talked about and the testing issues. I have people coming to me with vials of CBD every day that they got at the gas station. I'm like, please don't take that. At least go to somewhere like the Wellness Connection and get a reputable sourced vial of organic product that I'm at least relatively sure isn't your daily dose of just coconut oil and potentially formaldehyde. Just in quick summary, medical cannabis is a great option in hospice and palliative care when patients choose it. And patients and families need to enlist the knowledgeable resources to help educate them on the benefits. Tell your doctor, tell your hospice provider, tell the people involved in your care if you are using it. They don't get to tell you can't, but don't let them go in the dark, because there are reasons they should know. And it's nothing to be embarrassed about. It's a wonderful adjunct, but you've got to communicate. Enlist outside support, and advocate for yourself, or have somebody help advocate for you if you encounter resistance in using medical cannabis, and share your story. Because like we've seen here today, there are great stories out there that will help inspire change, and you never know when it could be yours. Thank you.